So in the same patient, we are seeing the coronal images. I'll start from the anterior most images. So we are able to see that there is definitely some fluid collection which is seen just anterior to the in one of the anterior most sections. This is the contralateral side. Then no such collection is seen. As we move a bit anterior to this black colored line, this we are seeing on both the sides. This would be the inguinal ligament, the expected region. We are not able to discern confidently on these images, but this is the hallmark area where we will be able to see the inguinal canal. So inguinal ligament, not the inguinal canal. Now as we scroll posteriorly, we will be able to see the inguinal vessels, and this fluid area is seen medial to it. These are the rectus abdominis. So this would be the medial head and this would be the lateral head, which both seem to be intact, and this is the external oblique muscle. This external oblique appears to be attenuated in the inferior aspect, so this is likely to be the tear. Now as this patient is an athlete, we would expect the changes of athletic pubalgia or the osteitis pubis, the chronic changes of osteitis pubis, wherein we see that there is marginal irregularities, degenerative changes at the pubic symphysis. These are more prominent on the right side. Also the intervening articular disc, the disc also appears to be deformed. So these are the changes of chronic osteitis pubis. Now one interesting finding that we see here is this fluid cleft, which we call the secondary fluid cleft sign. This is the primary fluid and this is the infrolaterally directed fluid cleft which we see, and this usually corresponds with the tear, this type of tear which we are seeing at the common rectus abdominis and adductor longus origin. So this patient is an athlete and has been having pain since a long time. So this is another finding which might attribute to the pain for this patient. This is a tear which is occurring at the common rectus abdominis and adductor longus origin. On the left side, no such thing is seen. However, just to be sure, we'll correlate on the sagittal images as well. Here in sagittal images, we are not seeing any fluid cleft. However, the delineation appears indistinct, so there might be a possibility of chronic tendinosis which might be occurring because of the strain in this region in the athlete. And one interesting finding which I have seen in this patient is the right-sided rectus femoris, the attachment, that the insertion of the right-sided rectus femoris, this tendon appears thickened on the right side compared to that on the left side. On the left side, we see it coming onto the anteroinferior iliac spine and attaching like this, but on the contralateral side we are seeing some amount of cystic changes which are occurring on this aspect at the site of the attachment at anteroinferior iliac spine, and this rectus femoris tendon appears thickened. So this might be correlating with a prior injury. However, no edema is seen, so this does not seem to be an acute injury. This is just a sequelae of prior injury. So this, in a patient, we need to be careful and just not be satisfied with a single finding. There can be multiple findings which are helpful for us to know and to see the scan thoroughly. Thank you.